Hi, and welcome to the Pet Healer Podcast. This is your host, Dr. Mitzi Vargas, and today we're going to talk about some of the new drugs that are in the market. Some of them are going to be receiving FDA approval. Some of them just did. Some are indefinitely in clinical trials, but they are very exciting for us practitioners because I, as an integrative practitioner, I'm always on the lookout for alternatives to all treatments that don't work. And obviously, I combine my therapies with the Eastern medicine wisdom and with the approach that is more holistic. But these drugs got me excited, particularly because some of them, we don't have any other alternatives. So the first one that has just granted FDA approval, it's Elanco's is the pharmaceutical that came up with Varenicline. And Varenicline is going to be a drug that is going to help kitty cats that have chronic kidney disease. And of course, the kidney has multiple functions. We know in Chinese medicine, the kidney has the Ming Men fire, the fire of lives, has the Jing, which is the telomeres, the ability to replicate your cells and to heal. And so, and it has other functions in Western medicine. It for example, it's associated with the amount of the bile in the stomach. And so it also is associated or has a role in determining in the bone marrow how many red blood cells you're supposed to be producing. And so kidney disease has multiple effects. It's a myriad of effects and systems that are affected when your kidneys are not working. Like I said, in Chinese medicine, if you die from kidney disease, then you live your full life. If you die from any other cause, then perhaps you didn't. And so the cause of the worsening of symptoms in cats is that they don't eat. And sometimes they don't like the foods that we're prescribing. Even with home recipes, sometimes they just continue to lose weight. Their bone marrow is not pumping out red blood cells. And so they become very anemic. And we used to have an erythropoietin, which is a drug that they use in people for the same cause, for aplastic anemia, for any cause of anemia. It really stimulates the bone marrow to produce the red blood cells. But we used the human product, and I remember many years ago I had a case, and I really did good with erythropoietin injections, and we got him out of the critical stage and went to live many years. So these erythropoietin, because it's for humans sometimes, and especially after COVID, you have difficulty getting these products, or sometimes the price have tripled. And so it makes it kind of like out of the budget of many people. But now Elanco is coming with this, which is an oral medication. I feel like it would be great that people can give this themselves. You don't have to be hospitalized. You don't have to, you can be prescribed this and then they do it. And so it is the main cause of euthanasia is just because these chronic kitties are just so pale. They just are so tired all the time, because if you don't have red blood cells, remember, they carry the oxygen. And in Chinese medicine, they carry the qi, right? So if they carry the qi and the oxygen, that's very, very important, right? So for quality of life. So FDA approved it because we don't have a lot of other options. And it has a good reasonable expectation to be effective in all the trials that they have done. And then it's just a once a day orally for 28 days. And then they might pause for about a week, and then they can continue to use it. The side effects that I saw was not that bad. Vomiting. It might raise their blood pressure though, because we're increasing the amount of blood that is available for the cat. So it raises the systolic blood pressure, which if you already have that problem, hyperthyroidism or kidney disease, sometimes does have already caused the high blood pressure, then it might increase it a little bit more. So they might need to medicate with that. And it does have a risk of thromboembolism, but thromboembolism is a risk anyway with kidney disease and anemia. So in some cats, so I think that it's I'm excited to try it, and of course I use it in conjunction with Rehmannia 6, which is the herb that I use for kidney disease in cats. It's very simple herbal formula, very old herbal formula, but still very effective. And of course acupuncture. So the kidney 2, 4, 7, and 10 are great points. Kidney 2, 4, 7, and 10. And of course, spleen 4, spleen 5, spleen 10, spleen 6. All of those are very good points for the kitty cats with anemia and kidney disease. So that's one of the ones that I'm so excited about. And then the other one, it's canine parvovirus treatment. So we know that parvovirus been around for a long time. I dread the word parvo because it evokes this bad situations where we've lost a lot, and especially in the beginning of where parvo started in the 80s and when I graduated the 90s, we had a lot of patients that passed away or that suffer, and they got better, but it suffers a lot. And the smell of parvo, this is just a parvo smell. It became an adjective in the community of veterinarians because it is just such a strong smell of decay and death. And so the canine parvovirus, I used to use some serum immunoglobulin from horses. It was a product, but I think it's out of the market for a couple of years now. But it seemed to help tremendously for the patients that I used it for. It did have a chance of causing an allergic reaction, though, but it was one way that I would treat the parvovirus. I usually use a blood heat formula for this, or red backdoor, which are two formulas that you can use for diarrhea, acute diarrhea, or for blood heat, morely for a disease that is so deep, because parvo is really deep. It just beat up the Wei Qi and it just penetrates the system. And so I definitely think that anything that can help will be great. But this is it has a conditional license, so it's not fully approved. But we're going to start to see this, being studied and used. And it is a monoclonal antibody treatment. And I'm excited about this because the monoclonal antibody treatment option for many diseases and many conditions, it's probably the most bioavailable, the most like holistic, really, in a way, because it's just trying to treat the body at the level that it is compromised. The immune system is compromised. So I think that the GI tract of these babies, that survive parvo, these are prone, in my opinion and my experiential knowledge, I see these dogs have IBD, inflammatory bowel disease, or multiple issues with pancreatitis and things over the years because their biome is just wiped out with the parvo. Their biome and their GI tract takes a while to go back, and you need to properly nourish it. The Gucci is so important for these puppies. They need to be nourished. They need to be built up, back up. And so our treatment usually is acupuncture and also herbs and also antibiotics as needed, and antiemetics and anti-diarrhea and fluids, obviously fluids, because they lose so much. It's like the Ebola virus in people, they just, everything, it causes hemorrhagic gastroenteritis. So it's just everything busts open, starts bleeding, and they lose a lot of the fluids, and they can just go down very quickly within 48 hours. And so there's no specific drug that would kill that virus. And that's why I guess this treatment definitely is exciting, because otherwise it's symptomatic treatment with the fluids, with the electrolytes, with the adding the antibiotics, preventing all those secondary infections and controlling the vomiting and the diarrhea, which is very bad. And so I think that the study that they did in the clinical trials, they tried it with 28 puppies, um, and they look like none of the ones that were treated died of parvo. That's big. That is big because we're not cookies. Dogs aren't cookies either. So we know that there's a individual variance, and that some breeds, for example, the Rottweilers, the Dobermans, are way more sensitive to parvo than, let's say, pit bulls or Labradors. Yet this is the study. They didn't say the breeds in here, but for 28 puppies, and none of them died of. And the resolution of the vomiting and the diarrhea was way quicker than the ones that were in the control group. That's incredible. That is one of the biggest things that can be out there. And I feel like it would be great for the people that do not have the money, because these parvo treatments in an emergency setting, like for example, our close emergency places, it could be in excess of $5,000-6,000 for just 3 or 4 days of treatment, because it's so intensive. And even ourselves, we have done outpatient care with them, with the people that are, they really cannot afford it. So we do the initial treatment, and we teach them how to do the fluid subcute and the injectables subcute and everything, and just how to baby, because it's very intensive in labor. You have to take care of them, clean constantly, make sure they're warm, because remember, they're just dehydrated and they're very cold. And so I think that I hope that it would be something that is more affordable. And if it cuts down in the amount that they are hospitalized, I feel that it's going to do so, because that's really the most expensive. It's just really the hospitalization of these babies. So I'm excited about it. I'm hoping that you guys, veterinarians that listen to me, are excited about those two. And I have 2 more to go, but we're gonna cut it. We're gonna do it part 2, so you have to be on the lookout for the next episode. And until then, stay healthy and stay well.